Hello and welcome to the Fit News Podcast. I'm your host, Jen Shaver, and joining me today is Janet Huehls. Janet is transforming the way we think about exercise from a should to a resource for whole person self-care for all. For 30 plus years as a clinician and coach, she has been guiding people with medical issues to use exercise to restore not just health, but also well-being. By integrating movement science, motivation science, and you science, mindfulness, into a simple step-by-step method, she eliminates the barriers of pain, stress, and low motivation, so exercise can be a way to be well now. She holds a master's degree in clinical exercise physiology, is a certified health and wellness coach, and a certified yoga teacher trained in mindfulness and self-compassion. Janet, thank you so much for taking the time to chat today.
Thanks, Jennifer. Good to see you.
Yes, I'm excited to talk. So
Yeah.
let's, I like to start with my guests and allow them to share how they kind of came to be and got to where they are now, and
Yeah.
almost like share your journey.
Yeah. Yeah. I went to college like everyone did after high school in that era and didn't know what I wanted to do. I had
Mhm.
no idea. And I started taking aerobics and then eventually started teaching aerobics. And I think I was at my sophomore year and I was like, I need a major. And someone said to me, I could get my master's in exercise physiology. I was like, what? I could do this all the time. It was like
This
somebody
is
just
a
handed me
job?
this great big gift. Yeah, like this is
Yeah.
it. And I was so excited and I applied to one grad school. I got in and so got my master's in exercise physiology and went the route of clinical and started in cardiac rehab and just loved it and
Mhm.
had a passion for cardiac rehab. I had an uncle, my godfather, with really severe heart disease and it really inspired me to want to work
Right.
in that field. And then working with all those patients, it was just such a fun field to be in. Um, and then fast forward a couple of decades, and I had my first child, and I had a bout of anxiety. After having him, I was like, "What? I'm going to take care of this human," and it just
Right.
caught me by surprise, right?
Yeah.
And a friend of mine had been doing yoga and said, and so I thought, all right, let me try yoga. And so I'd get up every morning and do this yoga video, and I fell in love with it.
Yeah.
So I went to get a yoga certification and started teaching yoga and doing yoga, and that led me into mindfulness and just um, and along those lines, I've always been so curious about why do I share this information about exercise
Uh-huh.
and people are not doing it. It
Right.
always just fascinated me, right? Like
Yes.
we
Well,
know
right,
it's good.
because
Yeah,
everybody knows, you know, that they need to do it, right? They all
right.
know,
It's a
oh, I'm
no-brainer.
supposed to do this. Right.
Yes, yes. And it's
Yeah.
become this should, and then in becoming a should, no one wants
Mhm.
to do it. And it's this big struggle. And I got out of school and I was like, what? This is like the best medicine ever. Why don't you want to do this? And I was always just so curious about motivation. And
Mhm.
I don't know, 7 or 8 years ago, I got my well coaches certification in coaching. And that was like, that kind of completed the whole circle, right? The
Mhm.
motivation, the movement science, and then the mindfulness, and then having the motivation science together. And it like all fell together
Right.
and that's when I started looking at my patients and saying, I don't want to let people get to this point. I work
Mhm.
in a weight loss clinic and a hospital weight loss clinic, and it's
Yeah.
kind of the end of the road. And I thought most of what I'm doing is undoing all these messages that we get about exercise that are taking people away from being motivated and disconnecting them from their body.
Right.
So that's why I started exercising well, because I just thought I want to prevent that by giving good information that has
Right.
all those three elements. Yeah.
Right. Right. And it's about changing that perspective that we have on
Yeah.
exercise, right?
Mhm. Yeah.
And that, I think
Yes.
that's the important piece, is to start
Yeah.
there. Let's change our perspective
Yeah.
on what
Yeah.
exactly is exercise, and how often
Mhm.
do I have to do it, and all of that, and
Yeah.
instead of maybe calling it exercise, maybe we change the name to movement, and
Right.
then it becomes a little more palatable almost, right? And
Yeah.
and
Yeah.
as overwhelming.
Right. So I have some patients. I had a patient the other day who really like exercise was a form of punishment for her as a child. And
Right.
she really could not hear the word exercise. So we had to use the word movement. And I totally respect that. I want to restore the word exercise because I
Mhm.
think it has these elements, right? Like, it has some details that are, if everyone
Yes.
just moves, we're going to lose muscle mass. We're not going
Yeah.
to be able to,
Right.
lift our arms overhead or do the
Hmm.
things that we don't get to do all the time. So I think,
Right.
my vision, and this might not be in my career lifetime, but I would like us to restore the word exercise to self-care, to really have someone hear it and
Yes.
say, oh, this is self-care.
Hmm.
And that's where the movement science comes in, right? It has to feel like self-care.
Right.
Can't be doing exercise that don't feel like self-care,
Uh-huh. Well,
Yeah,
and that's just it. It's,
yeah,
number one, let's start with what do you enjoy, right? So
yeah,
we'll get you
right,
started with what you enjoy. But then we
yeah,
also have to do some of those things, that, okay, maybe you don't enjoy strength training, but
mm.
do you enjoy being frail more? So
Right, right, yeah, yeah,
right.
yeah. And that's where I find the mindfulness piece comes in, because we
Mhm.
can use mindfulness to say, oh, I'm really, maybe what people don't enjoy about strength training is the fear, like they're worried while they're doing it. So if they're
Yes.
mindful, they're like, oh, I'm worried about my back every time I, do a squat. Maybe I have to clean that up a little bit so I can do it with more confidence. That's where I
Right.
like the mindfulness piece, so that people can learn from what their brain is telling, what their body is telling, what their spirit's telling them about how to make exercise, how to fine tune it so that it
Yeah.
does really feel good and not scary.
Right, right. And
Yeah.
or overwhelming, because I think a
Yeah.
lot of times
Overwhelming.
too, people just feel so overwhelmed
Yeah.
and, think, well, I need a whole hour and I have to go to this class and I
Yeah.
have to, and oh, I've got kids, I have a job, I have this, I
Yeah.
have that. How am I supposed to do that too? And then it just doesn't
Yeah.
happen, right?
Right. Exactly. Yeah. Yeah. I
Yeah.
think we, who talk about exercise a lot, like you hear those stories and you held the big picture, right, of all the
Right.
people that you've talked to. Um, and that's, I'm so glad you do this podcast and share this information. Like, no, it doesn't have to be,
Right.
I was
Right.
just on a webinar yesterday, and it affirmed what I knew as a physiologist, but I just wanted to make sure I talked to somebody who was a muscle soreness expert. And it affirmed that muscle soreness is not needed. There is no
Right.
scientific evidence that muscle soreness is needed, right?
Right.
But we think, oh,
Right.
good sore, it means I'm getting a good workout. But meanwhile,
Uh-huh.
it's telling the brain, don't do it. And I
Mhm.
really think soreness is one of those reasons why we struggle with starting. And in the meantime, if you just do a slow, gradual progression, you'll still get strong without being sore. So we don't even need it, you
Right,
know?
exactly. Oh my gosh. Yes, that's one of my favorite things because,
Yeah,
you know, obviously the saying, no pain, no gain, right?
yeah,
And
yeah.
that saying just needs to be put to bed now
It really
and,
does.
and
It
leave
really
it
does.
there because
Yes,
I think that that is one of the turnoffs, if you will,
yes,
of
yes,
why people do turn away from exercise because they have this idea that every workout needs to be a punishing effort or I
right.
have to get into beast mode or I have to
Yes.
all these things I have to it has to be really hard and I have to be drenched in sweat and that's the only
Yeah,
way for me to get a good workout and for it to work.
right. Yeah.
And you and I both know that that's not the case.
Yeah. Yeah. And it's really hard because we get all these messages and we have all these old tapes. I think a
Yeah.
lot of people I talk to are former athletes, right? Most
Mhm.
people have been involved in sports, and the no pain, no gain was for athletes. That's all.
Yes. Yeah.
Oh,
There.
okay. But we're back. We froze up a little bit.
Yeah. But
Technology.
yeah, it was for athletes and then
Yeah.
it kind of bled its way into everything else.
Right. Right.
And
Yes.
I think
Yeah.
it had a very negative
Mhm.
impact
Yeah.
on the way people perceive exercise.
Yes. Yeah. And especially the people who need it the most, right? The people
Right.
who have knee pain, arthritis, back pain, um, or the people who are busy, like you said, and have
Right.
kids and can't do a 1 hour workout. Yeah.
Right, right.
Mm.
And that actually brings me to a point that many of our listeners, do have they grapple with barriers like pain, like you just mentioned,
Yeah.
or stress,
Yeah.
or low motivation when it
Yeah.
comes to exercise, right?
Yeah.
So
Yeah.
I know that you have a step-by-step method that addresses this. So how do you in your program address these, issues with that step-by-step
Yeah.
program?
Yeah. I sometimes use the analogy of a plant or like a building, right? If you're going to start anything, you need a strong foundation. So we kind of take everything down to the studs. And my program just starts with the basics of like how to be in your body and rest first. So
Mhm.
rather than like, okay, let's go work out, how do we rest? Because rest is when we recharge. And so if
Yep.
we can't like just be in our body and know how to rest it,
Right.
then we're going to run out of energy really quickly. And then if we don't have energy, it's exercise is going to be the first thing to go. But if we can start by knowing how to be in our body well, and then how to use our core and how to move movement science based and really get the muscle memory for that back, like a
Right.
lot of misinformation about the core and all of that. And we
Ugh,
just kind of really rebuild that foundation, but also weaving in skills like mindfulness and self compassion and self trust and um, embodied confidence. So there's 6 embodied mindsets that we practice on that first week, like
mhm.
presence and kindness and trust. And then that's carried over through the rest of the program. So then we build on mobility, and then we build on strength, and then we build on stamina. But
Right.
everything's connected and everything builds on. So it's like growing a plant. And I always tell people, like, if you have a little tiny plant, you wouldn't give it more water and more sunshine and expect it to grow faster. But
Right.
we do that with exercise, right? We
Right.
think, oh, if
Well,
I
it,
do
it, it
this,
happens every
it's gonna.
January, right?
Yeah, right. Exactly.
And
Exactly.
it's for that reason why so
Yes.
many people, I mean, even
Yeah.
2 weeks after January
Yeah.
1st, have
Yeah.
already fallen off. And then
Right.
by February, the gym
Yeah.
is empty. It's back to
Yeah.
its, usual
Right.
suspects.
Yeah.
And it's because of that exact thing,
Yes. Yeah.
because they
Yeah.
didn't
So
start,
so
at the
right.
beginning.
Right. Yeah. So that's why I call the program Start Well. Like, start well. And people are like, well, how am I going to see results with this? And then by the second week,
Yeah.
they're like, oh my gosh, I love exercising. This feels so good.
Mhm.
Like, it's a resource. I can stop and stretch and I feel so good. And their pain starts to go away. And they just start to have energy and feel more comfortable in their body and sleep better and start to notice, oh, these are the benefits people are talking about. Like,
Yeah.
this is what it is. And they build that self motivation.
Right.
So that's a really big piece, is building that ability to be your best ally and lead your well-being. And so that's really what the program is building that intrinsic motivation, the self-efficacy, while you're building the movement
Hmm.
pieces in a way that you know how to adjust it. So you wake up one morning, oh, I didn't sleep well, I'm really tired. Normally you'd say, I can't exercise, I don't have time for that, I don't have energy for that full workout. But then you have all these resources to say, oh, how can I use exercise to feel better right now? How can I
Right.
use it? And so it becomes this really user friendly resource that you can kind of pull out and say, oh, okay, this could make me feel better right now.
Hmm.
So yeah, so that's how I do it, is really just kind of take everything down. And it's not like you have to stop exercising if you're doing something. You just start applying it to what you're already doing. And it
Yeah.
all starts to kind of just be easier,
Right,
you know?
right. And I think that's so important what you just mentioned, the self-motivation part
Mhm.
in
Yeah.
particular, because,
Yes.
if our motivation happens to be, something outside of us, right?
Yeah. Yes.
The chances, again, of
Yeah.
of us holding this habit
Yeah.
are pretty much slim to none.
Yes. And that's like motivation scientists know it. I always think the
Right,
motivation scientists are over there looking at us like,
right.
hello, we've got some good information for you, you
Yeah,
know? And I
right,
think, yeah. And, but when are we ever taught to be self motivated, right? We go to
right.
school where, everything is very externally
Yeah,
measured and driven, even sports and all of that. So I think
yeah,
we never really get a chance to learn those self motivation skills.
yep,
And, and so even whether I'm coaching somebody individually, we're always working on the self coaching skill, or in just the self coaching part of my program, it's woven into there
yeah.
so that they build those skills. Yeah.
Yeah. You mentioned something also in there regarding core
Yeah.
misinformation. So let's go
Yeah.
over that. Let's go let's dig a little deeper into some of the core misinformation, because I would like to clear that up, because
Yeah.
it's so important to
Yes.
understand
Yes.
what the core is, how it works, and what's good for it and what is not.
Yes. Yeah, I agree. And I think it even goes beyond our physical health, like back pain and all of that. I think it goes into our overall well-being. And there's even been some research about that, right? We've got a gut
Mhm.
brain and a heart brain that's in our core.
Yes.
So if we're
Mhm.
hiding it and feel bad about it and
Mhm.
disconnect from it, how are we going to tap into those, really rich
Yes.
resources? So yeah, so it's amazing to me because I look at, like, you look up an exercise like sit-ups, right? And if somebody's just looking at the muscles that you're working, your rectus abdominal, right? And they think, oh, okay, they attach here and here. The way to work that muscle would be to crunch, like to sit up,
Mm.
right? And so it makes sense from a muscle standpoint. But if you look at the way our body is designed to move, these muscles are not movers, they're stabilizers, right? So, and they're not stabilizers isolating. You might isolate to learn how to activate them and get the muscle memory, but then they're multitaskers. They're supposed to be part of every movement.
Yeah.
And I think that all the core exercises really just strain. And if you have a diastasis, a hernia there that you don't know about,
Hmm.
that could cause that and make it worse. So it actually can be weakening your core, not strengthening it. And a lot of people don't realize that. And
No.
the media sells it as, oh, you'll have a flat core, and you know, but I haven't done
Right.
sit-ups, planks in a really long time, and
Yeah. Yeah. Yeah.
amazingly, I didn't gain a whole bunch of fat around my middle, like,
Isn't that
and everyone I teach it
surprising?
to. Yeah, right. I know. And like back pain goes away and
Yeah.
people just feel so much more confident. And I
Hmm.
just taught it to, I had a senior class today and I taught it to seniors and they get it. And,
Hmm.
yeah. So,
Yeah.
yeah, I agree. It's such an important topic.
It is because it's just like you said, so many times I have heard women say, oh, I'm going to do this many crunches a day, or I'm going to do this many
Yes.
sit-ups a day because,
Yeah.
my belly is just, really
Right.
growing.
Yeah.
And you just want to scream.
Yeah. Yes. Yes, I do.
I mean,
Yes.
really.
I know. I know. Even my daughter, she's like, Mom, they made us do sit-ups again in gym class. And I'm like,
Ah,
just do one. Only do one. Don't do the rest of them.
yeah.
I
Oh my
know. Yeah,
goodness.
it's amazing. It just shows how much, and now, with the media, it's so hard to control that misinformation.
Yeah.
And so I'm so glad you're doing things like
Hmm.
this to get it out there because we just need to keep saying it. Yeah.
Right. Right.
Yeah.
Yeah. Because, again, not only do you risk injury doing that, but
Yeah.
you're just pretty much wasting your time, which
Right.
we both know that nobody has a lot of time. And if you're
Right.
going to take the time to do exercises,
Yes.
use that time wisely and do the
Yeah.
ones that are going to provide you results that are
Right.
going to help you now and down the road.
Yeah. Yeah. Exactly. You got to be smart about it. Yeah, I
Right.
agree.
Right.
Yeah.
Yeah. Um, how do you see the role of exercising evolving in the context of like whole person care?
Yeah. Yeah. Um, I'm biased, but to me, it's the foundation.
Hmm.
I think that if we can use exercise to reconnect to our body in a positive way
Yeah.
and do it mindfully, then it has ripple effects into noticing when you're doing stress eating or when you're emotional eating. Um, and because stress is like the foundation, right? It's stress is connected to every illness
Right.
that we have, and
Yep.
stress is our body ready to move. So if
Yep.
we make exercise stressful or anything that we're doing stressful for our health, then we're not really helping our health.
Right.
So we need movement. Like mindfulness is great, but it only gets you halfway there. If your body's still ready to move and movement is stressful or painful, then we're keeping ourselves in a stress state. So I see exercise as that foundation in that way when it's mindful, when it's science based, when it feels good, that it can
Mm-hmm.
completely clear that stress state. And then everything else works so much better.
Right. Right. Well, yeah,
Yeah.
because our body doesn't distinguish between good stress and bad stress.
Right.
I mean,
Right.
and we're
Yeah.
going to have stress in our life,
Yes.
but it's
Yeah.
managing that stress and using the exercise in a smart way that
Yes.
it's not adding, eh,
Right.
you know,
Yeah.
extra um, stress in a
Yeah.
negative way. Yeah.
Right. Yes.
Yeah.
Exactly.
Um, is there anything else you think that we missed?
We covered a lot.
Or yeah, okay.
Yeah.
Why don't we,
Yeah.
let's talk about the mindfulness in terms
Yeah.
of the science behind
Yeah.
that.
Yeah. Yeah. It's so nice to see mindfulness just weaving its way into everything, and,
Yes.
eating and habit change and addictions and everything, like chronic pain, everything. Um, and when I have people who ask, oh, I'm not good at being mindful because my brain
Hmm.
goes all over the place. I like to remind them that mindfulness is not being Zen. It's
Yes.
coming back into the moment. It's that flow of,
Yeah.
oh, my brain went here, here I go here.
Right. I think
And
that's important
yeah,
to distinguish or
yeah,
to you know, what exactly is mindfulness?
right,
Because I
right.
think there
Yeah.
might be people that don't understand what it is.
Yes. Yeah. I think that it's really just, I mean, the definition is being in the present moment with kindness and curiosity.
Hmm.
And so it's a way of being with what's here,
Hmm.
not that you're calm, but saying, oh, I feel anxiety in my body. Like you sense it in your body. You're getting into your
Hmm.
body. You're aware, oh, my
Oh,
thoughts are doing this. And then staying curious. So mindfulness is not just paying attention, it's saying, oh, I'm feeling anxious. Okay, what's that about? Oh, that's so interesting. Yeah, I'm thinking about this. I'm worried about this. Okay. And then it's saying, what can I do to help?
right.
It's responding to what we notice the same way we would do to somebody else. What can I do to help?
Right.
And that's the final piece of mindfulness that I think that is the game changer, right?
Hmm.
It lets us do the self-care without that self-compassion piece of it, then we're still a problem.
Right.
Whereas if we see ourselves as an ally, we can say, oh, you're anxious. What could you do? What can I do to help you right now? Oh, okay. I could do a little stretch and I could just take a little break, take a walk outside. Okay. That
Hmm.
worked. And now you use mindfulness to check in. To me, mindfulness and exercise go hand in hand because exercise, as you know, is that brain body connection. It's
Yeah.
muscle memory. And we need to be aware of our body. What it's telling us is
Right.
most important.
Hmm.
So if we're distracting when we're exercising, one, we're not getting the great muscle memory. So we're not activating as much of those nerve muscle fibers as we can.
Right.
And we're missing the signals that only we know inside. You could look
Hmm.
like you're doing everything great in the out and on the outside, but on the
Right.
inside, if you're not listening, you're missing that. So that's why I like to call it you science, because it's the science that only you can do. But
Right.
it's like a science where you're just like, oh, that's so interesting. My back's tweaking on doing that. Okay, what could I do to help? Okay, I think I'll realign and try that again. And
Hmm.
and just that's a flow of a very different mindset when you're exercising versus, oh, my back's hurting, I just have to push through it, or
Well,
gosh,
yeah.
my
Yeah.
stupid back, that going down that road.
Right.
Yeah,
Well, and I think in that, and I think, and then one thing that I always tell my ladies is
yeah.
when you show up for your workout, make sure that you are present for your workout. It's not
Mm.
just something that we're going to check off, right?
Yeah,
We don't just want to
yes.
check the box and say, got it
Right.
done.
Yeah,
Because
exactly.
when we do that, then it's exactly like you said, we're really missing out on a lot of the benefits. If we would
Yeah,
just slow down
yeah,
and be present with the moment that
yeah.
we are in and not be thinking about, I got to check this off the list. I got to go to the
Right.
grocery store. Don't
Uh-huh.
forget to put apples on the list.
Right.
All of those things.
Yeah.
Cut the noise
Yeah.
and focus on each movement that you're doing and that
Yes.
mind muscle connection.
Yeah. Yeah. It's everything.
And it's amazing how your results will change
Right.
with this simple step,
Yeah.
right?
Yeah. Yeah. It's like magic. I know.
Yeah.
That's so great. Your ladies are very lucky that you bring that
Yeah.
into that. I think that's
Yeah.
such an important element of what you do because we often think of it like a task and then we're
Right.
missing it. Like then we're really wasting time, I
That's
think.
just it. Yeah.
So
Yeah.
yeah, and that like you're making it self-care. In that statement, you're saying this is a moment of self-care. Like we
Right.
wouldn't do a massage and be on our phone. Like it'd be like, oh, I want to enjoy this. This is
Exactly.
self-care. Enjoy it. Yeah.
Yeah. Yeah.
Yeah.
So
Changing that
important.
narrative. Yeah.
And yeah, again, there are so many narratives with
Yeah.
exercise that
Yes.
need to be examined
Yes.
and changed. And,
Yes.
you know, once that happens,
Hmm.
it's amazing the doors that open for you
Yes.
with your health and your well-being.
Yeah. It's amazing. It ripples out into everything.
Right.
And we could make it so much easier to use this tool that nothing else does, right? Nothing else can do this for you. Nothing else.
Right.
So really need to be willing to let go of old ways of doing things
Hmm.
if we're gonna um, be able to enjoy this life,
Right.
as
Right.
individuals and do the best we can to take care of other people too.
Right.
We
Right. And
can't be kind to others. Like I love your sweatshirt because I
yeah.
think kindness starts inside.
Right.
That's what I tell my clients. Kindness starts inside. So if you could be kind to yourself,
That's so funny.
that
I just did a
narrative is going
post
to
on that
flow.
today because
Oh,
of
that's
the
so
sweatshirt.
funny.
It was, in the for our listeners who are not watching and who are listening, my sweatshirt says we all struggle, choose kindness always. And so, I said it's an important reminder, when working with others to always choose kindness, but it is also an important reminder for ourselves,
Yes.
you
It has to
know?
start there. Yeah.
Yeah. Yeah.
Yeah. We can just say to ourselves, what can I do to help?
hmm
That's
Yeah,
it's
instead
so
of always looking for the
powerful.
negative, right,
Yeah,
within
right.
ourselves.
Exactly. Yeah.
You
Beating
walk by the
ourselves up.
mirror and you see this, that, or the other that you're not happy with. Stop talking
Right.
to yourself like that.
Yeah.
Choose kind
Yeah.
words for yourself,
Yeah. Yeah. Right. Right.
Yeah.
Yeah. Yeah. It starts there. And I think that that's if exercise can be a practice of that, if that 15 minutes, half hour that you're doing becomes a
Mhm.
practice of talking to yourself that way, that's strengthening that muscle too.
Right.
Yeah.
Right. Right. And I love
Yeah.
that you just said 15 minutes to 30 minutes because again, there's going to be days
Yeah.
when it seems like, oh, I just can't do anything. Well,
Right.
again, what can you do?
Yeah,
Right.
it doesn't, right. So exercise is
What do
not
you have?
dictated.
Yeah.
Yeah. Yeah. I think one of the big things we need to change is this idea that exercise is burning calories. And I think it's the
Oh, yeah.
CDC or, that they define exercise or physical activity as anything that burns calories,
Oh, stop.
expends energy. And we really need
Ugh.
to change that narrative
Yes.
because it just doesn't help anybody.
No.
If it did, we wouldn't have weight loss surgery, weight loss medications. We wouldn't have the struggle
Right.
with obesity that we do. We've got to change that narrative and
Right.
more. I think of it as self-care, which means that it could be for 2 minutes, 1 minute, a
Right.
pause and just kind of a little stretch. Like
Right.
that's exercise. It's
Right.
practicing moving to practice taking care of yourself.
Yeah. Yeah. And
Yeah.
to improve your life, right? I mean,
Yeah,
exercise,
exactly.
the point of exercise is to improve your life.
Yes, right. Starting in
So
this moment.
if I
Yeah.
can do something to improve my life, why would I want
Yes.
to skip that? Right.
Right. Right. Yeah. So we just need to make it more user friendly and like show that it really can be that simple.
Yeah. Now, one thing I do want to mention before we end here, you have a great YouTube channel with so many
Thank
great
you.
videos.
Thank you.
And just tell our listeners just a little bit about that because I really want them to head over and take a listen,
Thank you.
take a watch.
Thank you.
They need to be looking at these.
Yeah.
So,
Yeah.
tell me just a little bit about those and then
Thank
how
you.
they can find those.
Okay. It's Exercising Well is my YouTube channel, and it's I really have been having fun with it lately in just talking like I'm talking to a patient
Hmm
or a client or somebody who had a question. So a lot of the topics are triggered by what people were struggling with.
hmm
And I really just want to share that information. Like I said, a lot of people are just get to that point
Yeah.
because of misinformation. And I think people show up there and they might think, oh, there's no exercises on there. Very few exercises on there because of that foundation.
Yep.
Because I think we've got to build that foundation first. So I
Yes.
don't just post exercises because I think that starting exercise is almost sacred. It's almost like that has to be something that you intentionally do. You can't just kind of pick out exercise videos
Exactly.
if you're struggling, if you're like,
hmm
oh, I just need to get in shape. Um, the exercise videos are great for people who are already exercising. But I think when we're struggling to start, having that
Yes.
foundation. So that's why I want to add information on YouTube that's really good, solid information that sends a positive message about exercise and says, hey, if you're in pain, here's some things to think about. If you're struggling with soreness, here's the science behind it, all of those things. So, yeah,
hmm
so it's really just very real
Yeah.
information based on what I hear people saying every day.
Yeah.
Yeah.
Yeah. Well, it is an excellent channel, and I hope that
Thank you.
everybody takes the time to go and,
Thank you.
watch some videos and learn a lot
Thank you. Thank you.
from you.
Thank you.
Where else can listeners find you?
So my website is exercisingwell.com, and I have
Mhm.
lots and lots of resources on there, and I have a newsletter list. So I send out a lot of resources on there.
Mhm.
On Instagram, LinkedIn, I'm on a lot, especially if you're a healthcare professional or anybody who recommends exercise for people.
Mhm.
Then on LinkedIn, I try and post a lot for other healthcare professionals to
Mhm.
change the narrative or,
Yeah.
just have a good narrative about exercise. Um, And that's basically it. I try and put a lot of stuff on my website because I really
Hmm.
want it to be a go-to resource. So lots
Right.
of blogs and articles on there, lots of guides for things like weight loss or back pain or fibromyalgia, things like that.
Hmm.
So a lot of the medical issues that can be helped by exercise, but there might not be encouraging science-based information out there. I try and put out guides for each of those medical conditions, like
Yeah.
diabetes, things like that. Yeah.
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 Wonderful. Well, Janet,
Yeah.
we appreciate your time today on the Fit News
Oh, you're welcome.
podcast, and we thank you so
Thank
much for
you.
taking the time to join us today.
Well, thank you for having me on. It was so nice to talk to you.
Yeah. Well, thank you for listening to the Fit News podcast, and we will catch you next time.